The calcium pill you swallow every morning to protect your bones may be leaving hard deposits in the walls of your arteries, and if you are anywhere in your 40s or 50s, that quiet process is likely starting right now, years before any routine checkup would think to look for it. I am Dr. Hale. In my 15 years in internal medicine, I have watched good, careful people do everything a magazine told them to do. They worried about their bones. They bought the biggest bottle of calcium on the shelf. They took 2 a day, faithfully, for a decade. And some of them still ended up with thinning bones and a heart scan that lit up with calcium in all the wrong places. That combination used to confuse me. It does not anymore. Here is what should get your attention today, even if your last physical came back clean. Where the calcium in that pill actually ends up is not something your body decides perfectly on its own. When you flood your bloodstream with a big dose all at once, some of that calcium may never reach your bones at all, and the place it can settle instead is a place you really do not want it. So in the next few minutes, I am going to show you the difference between calcium from food and calcium from a high-dose pill, and why your body treats them like 2 completely different things. I am going to tell you the 3 partners calcium needs before it will go where it belongs. And I am going to be honest with you about what the science actually says, including the parts that are still being argued over, because you will not get that honesty from a supplement label. Stay with me, because the mistake most people make is not taking too little calcium. It is taking it in the wrong form, at the wrong dose, all alone. Let me start with why your body treats calcium with such care in the first place. Think of calcium as the bricks in a building. Your skeleton is the building, and it is under constant renovation. Every day your body tears down a little old bone and lays down a little new bone. Calcium is the raw material for that work. But bricks do not stack themselves. You need a delivery crew to carry them to the right floor, and you need a foreman to make sure they go into the wall and not get dumped in the parking lot. When the bricks show up with no crew and no foreman, they pile up wherever they land. In your body, one of those parking lots is the lining of your arteries. That picture is the whole story of today, so hold on to it. Now, calcium from food behaves itself. When you eat yogurt, or a bowl of greens, or a piece of canned salmon with the soft bones in it, the calcium arrives slowly, spread across a meal, mixed with other nutrients. Your gut takes up what it needs and lets the rest pass. The National Institutes of Health Office of Dietary Supplements, which is about as careful and neutral a source as exists on this, makes a clear point here. Calcium from food has not been shown to raise the risk of heart disease. Food calcium, as far as the evidence goes, looks safe. A high-dose supplement is a different animal. Swallow 1,000 milligrams in one hard tablet, and you send a wave of calcium into your blood all at once. Researchers have a plain word for that spike. They call it a bolus. And that same NIH office notes the concern that these large boluses can briefly push the calcium level in your blood higher than usual, and that this may feed the kind of hardening we see in blood vessels. The bricks arrive all at once, with no crew, and some of them settle where they should not. This is the part I have to be straight with you about, because this channel is built on honesty, and I will not oversell it. The link between calcium supplements and heart trouble is debated. It is not settled. One large study published in the Journal of the American Heart Association, which followed a diverse group of older adults for 10 years, found that people taking calcium supplements tended to show more calcium building up in their coronary arteries over time, while people getting more of their calcium from food actually tended to have less. That is a real and sobering finding. But other analyses of supplement trials have found no clear increase in heart attacks or strokes at all. So the honest summary is this: some good research raises a red flag, other good research does not, and the experts have not closed the case. So what do you do with a question the scientists themselves have not finished arguing? You do the sensible thing. You lean toward the source that carries a possible risk on one side and no known risk on the other. That is food. Let me show you why calcium in the wrong place matters so much. Because this is the part that turns an abstract worry into something you can feel. Think of your arteries as the water pipes in a house. When they are young and healthy, they are soft and flexible, and they flex a little with every heartbeat, cushioning the flow. Now think about an old pipe that has built up a crust of hard mineral inside and out. It goes stiff. It cannot flex anymore. That is what calcium deposits do to a blood vessel over time. They stiffen it, like limescale hardening a pipe, and a stiff pipe forces the heart to push harder, which nudges up your blood pressure and adds strain to the whole system, year after year. This is not a problem that announces itself at 50. It is a slow crusting that begins quietly in your 40s and 50s and only shows its hand decades later, which is exactly why the source of your calcium is worth getting right now, while your pipes are still soft. And this is why the story is not the same for everyone. If you already have kidney disease, or diabetes, or existing heart trouble, your body manages calcium differently, and the stakes of getting a big daily bolus are higher. Those are precisely the people who should never be adding a high-dose pill on their own without a doctor weighing in. Let me tell you about a patient. I will call her Carol, and she is a composite of many people I have seen over the years. 59 years old, sharp, organized, the kind of person who keeps a pill organizer sorted by day. Her mother had broken a hip late in life, and that scared Carol. So years earlier, she had started taking a high-dose calcium tablet twice a day. No doctor had told her to. She read that it protected bones, and it made sense to her. More calcium, stronger bones. Simple. Except it was not simple. A bone scan showed her bones were still thinning, and a heart scan her cardiologist ordered for an unrelated reason showed calcium deposits in her coronary arteries that surprised everyone, given how healthy she looked. Now, I cannot tell you her supplements caused that. Nobody could. But when we sat down and added it up, Carol was taking in far more calcium from pills than her body could sensibly use, and almost none of the partners that calcium needs to be steered into bone. She had been sending bricks to a construction site with no crew for 10 years. And that brings me to those partners, because this is where you can actually change something starting today. Calcium needs 3 companions to do its job. The first is vitamin D. Think of vitamin D as the delivery truck. Without enough of it, your gut cannot absorb calcium well in the first place, so a lot of what you swallow never even gets picked up. Many people over 40 run low on vitamin D without knowing it, especially through the darker months, so the bricks are sitting on the curb with no truck to carry them. The second partner is vitamin K2. If vitamin D is the truck, vitamin K2 is the foreman on site. Its job is to help direct calcium into your bones and teeth, and to help keep it out of soft tissue like your arteries. Now I will be honest again here. The evidence on K2 is still developing, and it is not as rock solid as the basics of vitamin D. But the idea is sound, and the vitamin is found in ordinary foods, so it is worth knowing about. The third partner is magnesium. Magnesium works alongside calcium in a constant back and forth, and it takes part in helping your body use calcium properly. When magnesium runs low, that balance tips. And here is the quiet irony. A great many adults already get too little magnesium from food, so people load up on calcium while the very mineral that helps manage it is running on empty. You can see the pattern now. It was never only about how much calcium, it was about the truck, the foreman, and the balance. Bricks alone build nothing. If this is useful so far, do me one small favor. Take 1 second and subscribe to Dr. Hale and tell me in the comments how old you are, because the age of the people watching genuinely shapes what I dig into next. All right, back to it. because there is a number you need and a myth I promise to knock down. Here is the myth. More calcium equals stronger bones. It sounds obvious, and it is wrong past a certain point. Your bones can only use so much. Once you meet your body's needs, extra calcium does not keep stacking into stronger and stronger bone. Beyond a point, it just becomes calcium your body has to deal with, some of it heading nowhere useful. Bone strength is not a bucket you fill higher and higher. It is a living process that needs the right amount, plus the partners, plus the steady pull of exercise on the bone. A person can take a mountain of calcium and still lose bone, which is exactly what happened to Carol. So what is the right amount? The National Institutes of Health sets targets that most adults can reach mostly through food. For many adults, the daily goal lands somewhere around 1,000 to 1,200 milligrams, counting everything you eat and drink. And there is an upper limit worth respecting, roughly 2,000 to 2,500 milligrams a day from all sources combined, for most adults, above which the risks start to outweigh any benefit. The trouble is that people count the pill and forget the food. Add a fortified cereal, a glass of milk, a serving of yogurt, and a leafy dinner, and you may already be close to your target before the supplement even enters the picture. Then 2 big tablets push you over the line without you ever noticing. Food first is the whole game here, and the food is not exotic. Plain yogurt and kefir. Canned salmon or sardines with the soft bones. Dark leafy greens like kale and collards and bok choy. Tofu made with calcium. White beans. Almonds. A little cheese. Even fortified plant milks if you shake the carton, because the calcium settles at the bottom. Spread across the day, arriving with other nutrients, this is calcium your body has always known how to handle. You do not need to hit a perfect number or track every milligram. A serving of yogurt at breakfast, a handful of almonds in the afternoon, a big helping of greens, and a little cheese at dinner, and you are most of the way to a full day's calcium without a single pill and without a single spike. Your gut meters it out slowly, takes what your bones can use, and lets the rest go. That slow drip, not the hard flood, is how your body was built to get this mineral. And it is the reason food calcium has never carried the heart worry that the big daily tablet does. Now, none of this means every calcium supplement is dangerous, or that nobody should ever take one. Some people genuinely need one, and for them the right move is a smaller dose, taken with a meal, split into 2 rather than 1 big hit, and chosen with a doctor who knows their bones and their heart. The point is not fear. The point is that a supplement is a medical decision, not a snack, and it deserves the same care. Let me be clear about when this stops being a video topic and becomes a phone call. If you ever feel a racing or pounding heartbeat, chest pressure or chest pain, shortness of breath, or you feel faint, those are not things to sit and think over. Those get a call to a doctor, and some of them get an emergency call today. And if you have kidney disease, a history of kidney stones, a heart rhythm problem, or you take several prescriptions, do not start or change a calcium supplement on your own. Everything I have told you today is education, not a prescription, and it is not a substitute for your own doctor, who knows your body in a way the internet never will. So let us bring this together into a short list you can act on this week. Here is what to do. 1. Add up your food calcium honestly for a couple of days. Count the yogurt, the cheese, the greens, the fortified cereal and milk. You may be getting more than you think. 2. If you take a high-dose calcium pill out of habit and no doctor ever told you to, that is the conversation to bring to your next appointment. Ask whether you need it at all, and if you do, ask about a smaller dose split across the day and taken with food. 3. Make sure the partners are in place. Ask your doctor about your vitamin D level. Learn where vitamin K2 shows up in food And get your magnesium from real meals. 4. Lean toward food for calcium wherever you can, because food calcium carries no known heart risk, and that is the safest side of a debate the experts have not finished having. And here is the thread I want to leave you with. Calcium is only one mineral that can end up in the wrong place as we age. There is another common supplement, one that millions of people over 40 take for their heart and their joints, that may be doing far less than the label promises, and in some cases, may be quietly working against the very thing they bought it for. In my next video, I am going to walk you through it, so you know exactly what to check on your own shelf. Subscribe so it lands in front of you. Whether you are 45 or 75, you are never too early and never too late to get this right. And the version of you 10 years from now, with strong bones and clear arteries, will be grateful you started paying attention today. I am Dr. Hale. Take care of yourself.